We are seeing epidemics of mental health problems at the moment, and in school children, eating disorders, obsessive compulsive disorders, hyperactivity, anxiety are rife. And that results largely because of modern eating habits. I mean, our children are the worst carbohydrate addicts that we've ever seen, ever in the history of humans. And you look at the quality of their diet, and they're having breakfast cereals with fruit juice and toast, which are all high carb foods. They're snacking through the day with cakes and chocolate and sweets. At lunchtime they're having sandwiches with a piece of fruit and a bag of crisps, and that's considered a healthy lunch, and it absolutely isn't. And then in the evening meal it's pasta, it's bread, it's potato again. So our children are carbohydrate addicts. If we look at their blood sugar levels, they're going to be up and down and up and down. It's going to be looking like Rocky Mountains. And every time their blood sugar falls precipitously, the brain panics and pours out adrenaline. And adrenaline is the stress hormone. It's an unpleasant feeling being full of adrenaline. You're anxious, you're wired, you're fired, you're hungry, you're craving. And people satisfy, or they assuage that adrenaline hit by more carbohydrates. We call it comfort eating. When I lived in Nottinghamshire, the comfort food there was a chip butty. So in Scotland, it's probably a deep fried Mars bar. But it makes us crave sweet things and sugary things and carbohydrate things, and perpetuates the whole problem. So the starting point to treat any psychological condition, indeed any brain condition, is the ketogenic diet, because it irons out adrenaline levels, so you're not living on uppers and downers. You sleep better, and good quality sleep again is so important for treating any condition. I mean, I specialise in chronic fatigue syndrome. I invariably ask about sleep, and poor quality sleep alone will result in chronic fatigue. And gut function improves because you're not fermenting carbohydrates anymore, and therefore you're not malabsorbing, and so many cases of irritable bowel syndrome are driven by carbohydrates and sugars. So the ketogenic, it's just so important in all childhood conditions, but it's difficult. It's difficult to do it. It's difficult to persuade the parents of it. In fact, there's a case recently of an Australian doctor who was advocating the ketogenic diet in the treatment of a wide range of conditions. And he was taken to task by his professional body, our equivalent to the Australian General Medical Council. And they told him if he didn't stop advocating a ketogenic diet, he would be struck off. So there is huge resistance within society to the ketogenic diet. And it's perceived, it's cruel, it's dangerous. I mean, the starting point to treat diabetes is the ketogenic diet. But if patients suggest that to their diabetic consultants, it's open war between the two.
Right.
In fact, there's a lovely film being made about the treatment of epilepsy with a ketogenic diet. Again, it's been known since the 1920s that you can cure epilepsy with a ketogenic diet. And a film was made starring Meryl Streep, who was the mum, and a little boy Matthew, and it was about her battles with the medical profession to persuade them to allow her, and goodness me, allow her, is her son, to do a ketogenic diet. It was fantastically successful, and there's a lovely website up now called Matthew's Kitchen, which tells the story. You can get the film and lots of nice recipes as well.